welcome back. I'm Ava. I'm a registered nurse, and today we'll be talking about soft nursing and so much more. Okay, so let's get right into the video. So what is soft nursing? So soft nursing, and this is just my definition of soft nursing. Soft nursing is nursing that you enjoy. It's very light work. It's not too demanding. It doesn't give you too much stress or anxiety. It's something you can see yourself doing for more than 5 years. That is my definition of soft nursing. So with that being said, this is how I got into what I call soft nursing. Okay, so I used to be a bedside nurse. I worked as a medical surgical float pool nurse for about a year, and I got pregnant with my daughter, and during my nurse residency I ended up having her. So when I came back to work off maternity leave, when she was about 8 months, I transitioned into what they call inpatient virtual nursing. I didn't know it was a thing. I wasn't looking for remote work. It just the opportunity just kind of presented itself, and I was like, oh, okay, I'll give it a try. And now for the past 2 years, I have been practicing as an inpatient virtual nurse, and I absolutely enjoy it. If you follow me on TikTok at Ava RN, you'll see my daily vlogs or my day in the life vlogs that I've been posting. So yeah, I've absolutely been enjoying it, and it just comparing the two roles, being at the bedside and working virtually as inpatient virtual nurse, and just looking at the two roles side by side, all nursing is not like bedside nursing. And I'm glad that I was able to explore other options, because if all nursing is like bedside nursing, I did not want to be a part, because bedside nursing made me feel, I started losing parts of myself. I felt like I didn't know how to cope with everything that I saw, what was going on, the expectations of me as the registered nurse. And this was during the pandemic. So if y'all worked during the pandemic, then you know. And it was overwhelming. The workload was overwhelming. Patient acuity started getting overwhelming. The staffing levels was I was like, okay, I think I know and I've had enough. So I was like, I just need to step away and I guess try something else. And then inpatient virtual nursing, it just came into my life, and it's been great, because it just made me realize okay, all nursing, it doesn't have to be like bedside nursing, you know. And that first job, being a float pool nurse, that was my first nursing job. So that was my first experience with nursing, and I'm glad I didn't let that be the only experience that I had with nursing. So that is how I got into my soft nursing era, and a little bit about me. The next thing I want to talk about is the phases that we go through in our life, in our careers, that open us up or potentially open us up to become in our soft nursing era. So let's get into that a little bit. So phases in our life. What I'm talking about is your job or your position or your career. You have life changes, right? And those life changes, or your job, your career, has to reflect those life changes, right? So for me, my life change was having a baby. Okay, I had a baby, and I was struggling a little bit trying to balance working at the bedside and being a mom, and just trying to cope with everything a nurse copes with, working at the bedside and coping with everything going on with motherhood. So my life was changing, and this opportunity to work remotely as a nurse kind of presented itself to me, because the world was telling me that I was having a change in my life. Therefore, I need to have my career kind of reflect that. Okay, you have a child, how can we match this change? So the phase, it just kind of happened naturally. I was already kind of done working at the bedside, and then this opportunity presented itself. And now I'm in the phase where I am a toddler mom. My daughter is now 2. I've been working from home since she was 8 months. She's 2. And like I said, I'm a toddler mom. I'm in my toddler mom era. And what I'm doing as a nurse, what I'm doing professionally as my career, it matches what I needed in my life at this time. Now, I know it doesn't always happen like that, but when it does, you really need to embrace it. Don't fight it. Don't fight it, because I find myself fighting it sometimes, dang, maybe I should, do something else, or if this is what I'm supposed to be doing right now. Just take it in and let it be what it is, because when you reflect on this time of your life, you can be like, okay, I'm glad that I went through that phase, and this is what I had going on, And once you age out of this phase, like you did the next one, then the next opportunity will present itself. And we talk about this a lot on my podcast, or a little bit on my podcast. It's called the Nursing Connect podcast, where I sit down and I interview nurses who have made the transition from in-person to remote work. And they just talk about, you know, their life changes and things that happened to them that made them end up transitioning to remote work. If you like content like that, where we're sitting down talking about remote nursing and things like that, you're gonna really like the Nursing Connect podcast. And it's linked in my YouTube link description on my like front page. I don't know, I guess it's in my bio. But anyway, that's what we talk about. So yeah, really embrace the phase of life you're in, and make sure that your career is really benefiting, or the type of work you're doing is really benefiting you in the phase of life that you're in. Leads me into our last segment, and it's how to get into soft nursing. Basically, you have to listen to what phase of life you're in, like if you didn't catch that in the last few clips. So getting into soft nursing is just you basically taking a step back. This is if you're not happy with what you're doing right now as a nurse. It's just you taking a step back and reflecting on your career. How does it make you feel right now? Okay, you reflect on that, and you look to see what are the best options that make you happy and still bring in a good income, right? If working at the bedside does not make you happy, stop doing it, okay? Or go PRN, or go part-time, or, you know, just switch it up so that you can feel that love and that passion that you know you have for nursing. You just need to take a step back, look at what phase of life you're in, and try to get your career to match that. Because if you don't, you will stop being a nurse. You will not want to continue to work as a nurse. I will tell you that right now, because that was almost me. That was almost but yeah, that's how you get into your soft nursing, and you get the specialty that you want to be in, and you just, you know, like I said, this is really unique to nursing, being able to really mix and match and play with your profession and get it to match what you want it to do, because it's possible. It really is. That is how you get into soft nursing. So recap, how you get into soft nursing: you need to take a step back and identify what phase of life that you are in, and based on your phase of life, you need to make sure you find a career or a position, whether that's you going PRN, whether that's you working nights only, or whether that's you working remote or switching from bedside to outpatient. Like, whatever that looks like for you, just know you're doing that to match the phase of life that you're in. Okay, so that is how you get into soft nursing. All right, y'all, I made this video for nurses who are already in their soft nursing era or looking to get into their soft nursing era. And I hope this gave you a little bit of insight and, you know, positive energy around nursing. There's so much negative content that you can find around nursing, but I just want to put something really positive and great out there about nursing, because it really can be whatever you want it to be. So if you're in nursing school watching this, you can do whatever you want to do as a nurse. But I also want to let you guys know I am the chief executive of the remote nurse staffing agency, Nursing Connect. We place remote nurses. Right now, we're looking to place psychiatric nurse practitioners, inpatient virtual nurses, and remote nurse case managers. If you want to learn more, again, you can go to the link in my bio on my homepage of my YouTube, and I have the Nursing Connect website up. We don't have any open positions right now, but we're still accepting applicants and we're interviewing them. So if you're interested, if you have any experience in those roles, please submit a resume. Again, my name is Ava, and I will see y'all in the next one. Bye.